Top 5 Unexpected Societal Issues from COVID-19. Number 1. Kids can't improve their immunity. Staying at home and not being exposed to the dirt and pollution outside should make your kids healthier, right? Not necessarily. For young kids where their immune system is still developing, over-clean environments can negatively influence them. When kids play outside, and you expose them to allergens, they will be less likely to develop asthma or allergies when they grow up. Quarantine is denying small children this immune-boosting opportunity. However, your older kids' immunity will not get worse by staying indoors. Number 2. Overeating into obesity. Not only does severe obesity qualify you as at risk for COVID-19, but the pandemic is causing people to overeat as well. Stress or emotional eating is a common phenomenon. Consumption of food can numb out unpleasant feelings. Many people found themselves gaining up to 15 pounds during self-isolation. That the term Quarantine 15 started circulating on social media. Stocking up on food in case of limited supplies and being close to the kitchen pantry at home all day possibly contributed to this. Did you know that overeating is also one of the uncommon side effects some people experienced after recovering from the virus? Indian news sources quoted a physician from the Apollo hospitals in Sishutripuram saying people who lost taste or smell during their COVID-19 illness started binge eating after recovery. During their 14-day isolation after the illness, people are gaining weight, Dr. Dinesh V. Kamath said. We are seeing many recovered patients in the age group 40 to 60 years putting on weight. They say they have been overeating. Number 3. Increase in physician burnout. With increased patients with severe COVID-19 symptoms in hospitals, we may have expected the limited beds and reliance on healthcare workers. But how are the physicians treating all these patients doing themselves? Statistics say not so well. COVID-19 increased the workload on physicians and directly led to increased burnout. A Medscape survey released in September 2020 of 7,500 doctors globally highlights just how bad physician burnout has become during the pandemic. Of the total doctors, 5,000 practiced in the United States, and 64% of these physicians said the pandemic intensified their sense of burnout. The main reasons for the stress were treating patients likely to die and being exposed to the virus without proper personal protective equipment, PPE. A fifth of physicians in Spain and the U.S. said they ended up catching COVID-19. Unhappy and overworked physicians are dangerous society issues. Not only do we rely on physicians to be alert to do their jobs, but if they decide to quit, a lack of healthcare workers can prove fatal for those needing their care. They cannot all take a vacation at the same time, but our physicians need a break. Number 4. Over-drinking into alcoholism. Stuck at home, isolated, and worried about the pandemic effects can easily lead to picking up the bottle and drinking your worries away. Some people also believe that alcohol prevents COVID-19. This assumption is not true. The National Institute on Alcohol Abuse and Alcoholism, NIAA, had to release an announcement on May 12, 2020, to remind people, drinking alcohol does not prevent or treat coronavirus infection. Although a hand sanitizer contains alcohol and a glass of wine can ease some stress, drinking too much alcohol can make your immune system weaker against COVID-19. Research on 1,540 adults ages 30 to 59 years studied the change in alcohol consumption in 2019 and 2020. The data from 2019 was from April 29 to June 9, and the 2020 data from May 28 to June 16. The results found that overall alcohol consumption increased during COVID-19 by 10%. However, women consumed more alcohol by 41% more. Women also experienced a 39% increase in adverse consequences associated with alcohol. These rising drinking patterns can be a potential sign of alcohol abuse and addiction. Number 5. Spread of touch deprivation. Yes, touch deprivation, also known as touch starvation, is an actual health condition. Physical contact is important for humans in multiple ways, and isolation combined with social distancing has prevented people from receiving the touch they need. Human touch can decrease anxiety, expand trust, and improve your health by improving your immunity. A study on premenopausal women found that hugs from their partners lowered their blood pressure. The director of the Touch Research Institute at the University of Miami, Tiffany Field, has linked the absence of touch to anxiety, depression, and lowered immunity. In a different study, she found that 68% of participants felt like they were touch-deprived during the first COVID-19 shutdowns. This number increased by 50% within a month.